Welcome. My name is Dr. Kevin Fanton, Director of the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention at the Centers for Disease Control and Prevention. I am pleased to introduce you to the NCHHSTP Atlas, our latest innovation to provide you an online visualization of CDC's surveillance data. Now, using the Atlas allows you to identify areas of the United States that bear the greatest disease burden and to view epidemiologic data across our disease areas, including HIV/AIDS, other sexually transmitted diseases, including chlamydia, gonorrhea, primary and secondary syphilis, as well as viral hepatitis and tuberculosis. This tool can help public health professionals confront syndemics or overlapping epidemics in more efficient and impactful ways by providing the information needed to better tailor resources and interventions to meet the need in those areas hardest hit. The NCHHSTP Atlas also helps users examine disease trends over time, identify disparities by race, ethnicity, gender, and age, and recognize opportunities for program collaboration and service integration. Now, to ensure you are able to fully utilize this exciting new tool, we have provided a tutorial to walk you through the application, how it works, and some of its key features. I hope you will take time to explore the Atlas and use it in your prevention efforts. Thank you for your work and your commitment to disease prevention and health promotion. Enjoy the tour.
Welcome to the Centers for Disease Control and Prevention's National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention Online Atlas. The Atlas was created to provide an interactive tool for finding and using data collected by NCHHSTP on HIV, AIDS, viral hepatitis, sexually transmitted diseases or STDs, and tuberculosis or TB. This exciting new tool is interactive and provides a new way to learn about and explore these data. It gives you the ability to create detailed reports, maps, and other graphics on trends over time and patterns across the United States or in your own community. Let's take a look at the Atlas and walk through some of its key features. When you open the Atlas, the default query is displayed. These highlighted data will change frequently based upon more recent data available in various awareness days or other events to be highlighted. Atlas also gives you the power to create your own custom analyses. The query menu contains elements from which you can choose to customize your data request. Start here, beginning with disease and year. If you select change over time, you can use the play trend data function. Next, you can select a variety of demographic variables such as race, ethnicity, sex, age group, and transmission category. The variables you are able to select for the different diseases will depend upon the data that are available. Next to all the drop-down buttons is an eye icon. By clicking on this icon, you can access information on the drop-down options. Once you make your selections, click the Update Map button once. Your respective data and graphics will be displayed. Recommended queries are provided to assist you. NCHHSTP scientific staff drafted these to highlight some of the most important data. Once you select one of the recommended queries, clicking on Show Query Description provides info on why this query is recommended, as well as links to additional data and information. In the Map Options section, you can access a variety of choices to customize your view of the map data. You can select color ramps, number of classes to group the data in, and the classification scheme. You can also use display options to change your view to map only, table only, or map and table, which is the default setting. As you explore your query, more of the interactive capabilities of the application will appear. The map, table, and legend are all interactive. The table can be sorted by any of the columns. The default order is by the Federal Information Processing Standards Code, or FIPS code. As you explore the Atlas, keep in mind that the tool includes data for HIV, AIDS, some STDs, viral hepatitis, and TB. You can easily toggle between rates and cases. In this application, rates always refers to rate per 100,000 among the selected population. You can also view additional data and graphics for the diseases by selecting variables in the National Data section. Default is year. If you toggle to cases, the pie chart will display. By double-clicking on a state, both state and national data will be shown for comparison. Your query remains constant, but you can compare differences between the selected area and the national data. The eye icon in national data provides important information about the data displayed. Be sure to read it. In the Export Share section, you can export the data as an Excel file or a PDF file. Finally, be sure to read the About These Data and footnotes, as well as the frequently asked questions. The footnotes can help you understand the surveillance data. The frequently asked questions contain additional information about the application. In the page footer, there is a Contact Atlas link to which you can ask additional questions or give feedback. We will continue to adapt Atlas with new functions and more data over time, so please continue to explore and use this data resource and send us your comments on how we may improve by emailing NCHHSTP ATLAS@cdc.gov.